Julie and I share an interest in protecting women against HIV and in promoting reproductive and sexual health of women, and we've tried to work together a number of times in the past. We come at this sort of set of solutions from different perspectives. Julie is she's from MCH, she's very global in her focus. She looks a lot at cost and cost effectiveness and willingness to pay. And I'm in JP division, and I've traditionally been pretty domestic in my focus and looking through the lens of sort of disparities and behavioral change and social and cultural factors and health disparities. So now we're looking at these multi-purpose technologies that can be used for both reproductive and HIV protection, and condoms, diaphragms, vaginal rings, gels, and films, and trying to find a mechanism for us to work together. We have worked together on a couple of pre-proposals that we put into Gates, where we actually were approached by companies that are developing these technologies who seem to have a gap in their ability to really use these other skill sets that Julie and I have, like looking at willingness to pay and looking at willingness to use and behaviors around use of different devices. So, Julie's next.
Oh, okay. One of the companies that we are working with is, to give you an example, is a company biotech company in San Diego that is producing antibodies against that neutralize HIV and neutralize HSV and also neutralize sperm. And then, so what they're interested is impregnating these in vaginal rings and in films or gels, and then so that the women would have protection from a variety of different infectious organisms.
Other swimming types.
Right, exactly. But yes. And so we are now looking at putting in for example, a program, responding to a program announcement from the NIH to look at to study feasibility and acceptability for these mechanisms. And we are we've been searching out if any of you can give us suggestions for very high HIV transmission populations.
I'm Coco Oswald, and I've been affiliated with the School of Public Health for 8 years, but you wouldn't know that unless you spent time on the 5th floor. And now I'm based here and have an adjunct position at UCSF, and I'm super happy about that. The 2-minute presentation we want to talk about is I for Y, so Innovations for Youth, which is not just a proposed center, I think a center that will take place, that will materialize regarding adolescent health and development. That's going to be a collaboration between the Institute of Human Development, headed by Ron Dahl, and the School of Public Health. And this came out of a realization that we really had a pretty significant quorum of people working in adolescent health here. We started meeting about a 1.5 years ago with a sort of a core group of about 8 people, but realizing that there's probably about a dozen people, so probably a fourth of the faculty actually working in adolescent health here. And the center is going to be focused on looking at, my latest term is synapse to society, so really thinking about multi-level determinants and pathways to adolescent well-being. So understanding more about how adolescent health gets into the brain and gets into the body, gets into telomeres, gets into obesity, gets into a lot of health expressions, as well as looking at how social policy affects adolescent health, looking at how economic policy affects adolescent health, and then more importantly, because I think a lot of these things actually have been shown already, trying to think about how we can take that information and turn it around to interventions with youth as well as for youth to improve the health of adolescent populations. Did I talk for 2 minutes?
You did.
Excellent.
You did a great job, though.
Sorry.
I'll just add a couple of pieces. So I think what we're excited about doing, all of us are busy, but I think we have this sense that there could be a lot of synergies across not just faculty here in the School of Public Health, but across campus, whether that's psychology, social welfare, education, many other departments. And so what I'm motivated about here is to create a community of people where we can do something that we can't just do alone in terms of going after much more ambitious types of projects. And as Coco referred to, from my point of view, it's not just about understanding the effects on development, but really doing work that's relevant to practices and policies for settings that affect child and adolescent development. And so this was an agenda item to just sort of do a shout out and to let you know, and to sort of, I know everyone's really busy, but that we're sort of we're taking some leadership here and really want to know, we really would love to have people engaged. And one of the first things would be to potentially present at the Institute for Human Development at some of the seminars there, but really just be in touch and we'll be in touch, but kind of let us know who wants to be in the loop so we're not harassing you. So.
And we are having a seminar series now on Mondays at noon, focused on this transdisciplinary and trans-level perspective on adolescent health. And the first 2 talks were really fabulous. So the second one was
okay. And thanks. And one thing I'll just say is that what I'm hoping we can create is the kind of collaborations across disciplines, across methods, where we're really engaged in each other's work and not just sort of hearing about it for 2 minutes. So a big piece of my work for the last 10 years has been focused on participatory research with young people, particularly urban youth. And so that's engaging in sort of both promoting and studying how training young people as researchers to study problems that affect them and they want to change affects both their development as well as their school settings and communities. So that's been a big piece of my research. And over the years, I've had a little bit of contact with the CHMHD project and sort of hearing about, and sharing some of my work with that project. But Kim and I spoke last week for this talk, and we realized that a project that I'm just getting off the ground in San Francisco with my partner organization for many years, which we're calling the Youth Research Hub, which would be a web-based way of kind of scaling up and scaffolding youth research across sites, across countries potentially, so that the young people who are doing this work can be in connection with each other and can also make their work more impactful in terms of decision makers. That the CHMHD study that Kim and Brenda and others have been working on for so many years, that your group, the Hermosa sort of subgroup who's been studying how toxic chemicals in makeup and other kinds of beauty products affect young people and trying to make changes, that group could probably connect with the students in the Youth Research Hub, and they could send some video about what they're doing, and there could be some really great interactions. And so just our brief conversation in preparation for this, I think we can already start a collaboration in that area. They've been building on, obviously, Mary's consultation and collaboration there, but it would be really exciting for them to connect. And then as well as other ways, like potentially embedding the kind of measures that I've developed in my research into these youth research hubs, so they're not just, we think about scaling up the practice, but also scaling up how it affects young people. So, thank you.
How many of you heard of the new Berkeley Food Institute? So just like a third of you. So more, third to half of you. So a funder has come to Berkeley and is funding this Berkeley Food Institute that started out of the public policy, journalism, and this College of Natural Resources and the Berkeley Law School. And then just recently, where's the, oh, no, it's off. That one. The School of Public Health. We were an afterthought.
We were a real afterthought.
We were a real afterthought. But
that's why it was small.
And it's not well formed. There was a big kickoff symposium back in May, and it's trying to do many things.
Try to advance. I'll do it.
Yes, thank you. So they're the partners, and then one more. And we have signed on this group, myself and Pat Crawford, Leah Fernald, Chris Mattson, Brenda, and Asa. And anyone else here wants to join us?
It's all about food.
Okay.
I'm also on the list.
Oh, you are on the list, sorry.
Oh,
That's
okay.
good to know.
We didn't see you at the meeting, so.
Yeah, and we would like to expand it across the whole school, because there's other people who are interested in food. But the mission is to conduct interdisciplinary research to support the transformation of the food system into one built on diversity, justice, resilience, and health. And I think that the focus really right now is more on the agriculture side and less so on the health side. Climate conditions, water, you know, the farm worker, and that's all great. And so we're trying to infuse more of the health. Health is always kind of the underlying issue of why it's important, but it's never really at the fore. And what else do we want? Do you want to talk? Okay. And so here's some more goals. We can pass this because we're going to be out of time.
So basically, there are some of us here, like Ace and myself and Kim, who work on chemicals in food, and but there's also the need to do research on how to bring good food to the table and food preparation and to the families. And what Barbara and I are particularly interested in are pregnant women and children and making sure that they have good food. And that also means that they're food secure, which is a problem for myself in particular, working with farm workers, that 50% of them are food insecure is just tragedy. So we need to train students, however, as part of this project, as part of this program, and that's where we got really interested. And that is that we wanted to improve the food and food security of pregnant women and children. And as you know, Public Health Nutrition has just gotten this MCH Nutrition Training Grant, which is great. And what Barbara and I were talking about, Sylvia, is that we were going to Ray. but Sylvia and I have been talking about this for years, that we wanted to resurrect the idea of getting an MCH epidemiology training grant, and that's something that we're going to begin to look into as part of this new pair. And then we know there's lots of people around here who would like to be part of that too. We don't know if there's an RFA out right now, but that's something we're going to look into and see if we can.
We're going to submit it anyways to do the T32 by May. It would be nice if there was a mechanism.
Okay?
Yeah.
So we're going to work mostly on food and health, but we're going to bring that Berkeley Food Institute to hear something about food and health.
Actually, Sylvia and I started working together briefly with the R21 and the R24, which were structured around looking at very early life development and its implications for health later. It turned out that both of us are interested in gestation. I'm interested in the causes and effects of selection in utero, and Sylvia was interested in a particular environmental influence on selection in utero and immediately after birth, which was maternal leave and the work experience, which tied into the research I had done on the effects of labor markets on health. So as that work went along, I think after the R24 we didn't work very much together, but now we've decided that we're going to go back to that because we have such clear intersecting interests. And since you forced us to do this, we're going to. Right.
And so what I can add is that I think there's a lot of room for understanding workplace as place in public health that we don't do enough. Mm-hmm. And the fact that my interest in maternity leave dovetails with what happens when the economies are going up and down in terms of recessionary or growth periods. So we intersect a lot there, and we would love to have more input from faculty around what can be done in terms of interventions around the workplace that will affect the fetus. But there's the other side of my research that also intersects with yours, which has to do with when you say it's all about fetal deaths, miscarriages, blah, 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 very early terminations, abortions. I keep thinking, well, what happens with preterm? And so I think that understanding just birth outcomes from conception all the way to a live birth is another sort of weave or sort of area where we can
Right.
sort of add a lot of
To our PhD students
partnerships
as well.
and bring more of you who might be interested in some of those.
Yeah, actually, we have students that we both work with, and Robert Wood Johnson, for example, right now is supporting one of them who's actually in demography to do a life table of gestation, and that work is now done. And that was very difficult work to do. You might think we know a lot about that, but it turns out we don't know much about that. But we now know enough to be able to piece together different studies to try to get some sense of what's happening over gestation. And we think that in this work, there's going to be some very provocative findings that are going to make people feel uncomfortable about things and about the implications of, and there are things we'll disagree on, I'm sure. And I'd imagine in this room there would be disagreement about some of the principles. I'm an economist, so my view of this is, hi to Bill. Bill Jagus doesn't know about a conversation we had very early on about how deep choice goes into our biology. And it was actually from that conversation that I devised this work on the decisional biology of gestation, because it appears that the decisions that are made throughout gestation are very rational in a classic sense. They are well described. And we've talked about this, that the argument that somehow the bad outcomes of gestation are the function of the dysregulation of biology seems untrue, that many of the outcomes of gestation are the function of very well-regulated, very predictable biology and very rational decisions that are made not consciously, but made the way a neuroscientist and an economist would agree. People have counterfactuals about what the future is going to be under various alternatives, and they compare it, and then they pick that which is in their best interest.
We study obesity at the Center for Weight and Health, and I've done a lot of work looking at opportunities for physical activity that kids might have. One of the things we found was that kids who walk to school are fitter. They run a mile faster, but they're heavier as well because they stop and they buy food on the way to school. Right? So I can get them active, and I can get them to burn calories on the way to school, and they can make it all up in 5 minutes with a bag of hot chips. So corner stores are a problem, and that's where Mary comes in.
Gee, okay. Well, I reached out to Chris because I heard she was interested in healthy retail, which is an area I've been getting more and more involved in. I've been kind of involved on the periphery with the Healthy Neighborhood Project in Baby Hunters Point, which was the genesis for the work that I'm doing now in the Tenderloin on a Tenderloin Healthy Retail Project. Very briefly, for those of you not familiar with it, this was a relationship between the health department and Literacy for Environmental Justice, a youth-driven organization that did really phenomenal work. They did a lot of GIS and surveys, but they also did things like this with high school kids going in and actually getting permission to measure the amount of shelf space devoted to fresh fruits and vegetables, 2%, versus alcohol and tobacco, 26%, and fast food and the rest of it, or the processed food. Anyway, that kind of data, more than anything else they uncovered, was very much of interest to policymakers. The city got behind us. This was just before the recession, and the agreement was made that stores that agreed to make certain changes in the way they did business would have a number of helps, of incentives from the city. It was working very well. The pilot store, I followed them over time. In the first 7 months, saw real changes with produce as a percent of sales going from 5 to 25%, alcohol and cigarettes dropping. The last time I followed up, the sales from fresh fruits and vegetables were up to 17% of total sales. The guy said jokingly, I'm going to have to sell more tobacco. This is crazy. In fact, he doesn't have to, because the profit margin on tobacco is 11%. Fresh fruits and vegetables, it's about 40%, and of its packaged salads, it's 90%. So part of it is teaching the store owners. Well, again, I became really excited because 30 years ago, my students and I were in the Tenderloin for 16 years. We started a nonprofit. The second biggest issue after crime was lack of access to healthy food. And when I found out this was still the second biggest issue in the Tenderloin, I wanted to be involved. So I'm now working with the Tenderloin Healthy Corner Store Coalition with some of my students. I've also, and just quickly. They did a shopping guide. I'm going to pass this around. This is the most lovely thing. They couldn't get into a few of the stores. There's 71 corner stores, no grocery store in the Tenderloin. They got into 51 and did detailed I'm sorry, this is all one. No, this is all one document.
Oh, I'm
So
sorry.
keep it together if you don't mind. It's 53 stores with their picture, their healthy highlights, whether they take WIC and CalFresh and so forth. It's been, and their stores get a rating of 1 to 4 stars. It's given out to all the people in the Tenderloin, telling them where you want to buy, who cares about your health. The ordinance just passed. We had 2 hearings, and it passed a week or 2 ago. And basically now, under this ordinance, if you want government help, you have to have 35% of your space devoted to healthy food and less than 20% to alcohol and tobacco. It's a very exciting project, and I look forward to working with Chris, and we are probably going to be, I shouldn't say probably, we are applying for a grant that the UCOP Office of Tobacco is very interested in, so we're hoping to be able to move